New Bedford became one of the first cities in the nation to require city workers to get vaccinated or face regular testing. So joining us now is Dr. Shira Doron, the hospital epidemiologist at Tufts Medical Center. Dr. Doron, so great to see you. We always appreciate your time and your wisdom. Boston is considering some kind of city worker mandate, considering New York City already made that move. So do you think we're going to see more of this? And do you think it's an effective strategy?
Yeah, I think we've reached a tipping point where more and more cities, states, healthcare systems, and employers are mandating vaccines and paving the way for others to do the same. Now, given that we've hit a wall really with vaccination and failed to vaccinate enough of our population to protect against the rise in cases that we're seeing and the surge in hospitalizations in some parts of the country, I see no other way. And I think this is absolutely the right approach.
So Dr. Doron, let's talk about a couple of things that are going on in our immediate area. And we have some video of the Revere Beach Sand Sculpting Festival that is back tonight. It's a popular event that was canceled last year because of the pandemic. Tens of thousands of people are expected to attend. Of course, you've had concerts at Fenway Park all week. The Red Sox have played at Fenway Park. How concerned are you about events like this as we watch the COVID numbers climb?
I'm not concerned about the people on the beach. You know, outside is so safe. I'm concerned about events like this when they lead to unvaccinated people, some of them perhaps traveling from hotspots around the country, congregating in bars and other crowded indoor settings after the outdoor events are over. So I would really suggest caution around those types of activities.
So you're still saying outdoor events right now, okay?
Outdoors is the best ventilation, and the ocean is the best ventilation there is.
All right, so let's talk about vaccinations. They're starting to climb again, the numbers. New data released by Johnson & Johnson provides more incentive, possibly. What do we know about their new study in the Delta variant?
Well, this is a huge study, nearly 480,000 healthcare workers in South Africa. Now, it's still just a press release. I haven't seen the data myself, but J&J says that their vaccine was 72% effective against hospitalization during the time when Delta was predominant, and up to 96% effective against death, with durability of that effectiveness out to 8 months after vaccination. So that's better than it was performing against the South Africa or Beta variant. So that's excellent news.
Dr. Doron, thank you so much for your time. We greatly appreciate it.
Thank you, doctor.
Take care.